Hi, my name is Terry Calandra from Calandra Center for Health and Wellness. And in this presentation, we're going to be discussing anxiety and traditional Chinese medicine. Traditional Chinese medicine is a helpful integrative option for treatment of anxiety and anxiety disorders. Many of the clients at CCHW come in with physical and emotional complaints related to stress and anxiety. Prior to discussing anxiety, its symptoms and treatment options, both within Western medicine and traditional Chinese medicine, it is important to differentiate between anxiety and stress, especially since the two terms are frequently used interchangeably. During today's presentation, I'm going to discuss stress versus anxiety, the Western definition of those, Western medicine treatment options, traditional Chinese medicine and anxiety, and also offer some quick tips to help with anxiety. So, what is the difference between stress and anxiety? So, what is stress? Everyone has experienced stress in their lifetime. Stress is the body's response to any physical or physiological stimuli that are called stressors that disrupt homeostasis. That's the body's natural state of being. Physiological and behavioral changes in response to the exposure of a stressor is called a stress response. Stress responses are mediated through a complex interplay of the nervous system, endocrine system, and immune mechanisms within the body. It's adaptive, so it helps prepare the body to handle internal and external difficulties. Exposure to chronic or extreme stress can lead to depression, cognitive impairment, heart disease, anxiety and other stress-related disorders. Not all forms of stress are detrimental. Take, for example, this picture. For those that love to ski, it can be invigorating, it can be stimulating, and can bring a lot of joy. And also, if you lose control and start heading towards a tree, it can be very stressful. So positive stressors are enjoyable, they're stimulating and inspiring. They replenish our energy, enhance cardiovascular health, they boost endurance, and sharpen cognitive function. The body responds to stress in two different ways. There's the fast response and the slow response. The fast response uses the activation of the sympathetic adrenomedullary SAM axis in order to help with that immediate response. Stressors trigger sympathetic nervous system, which then have the medulla release epinephrine and norepinephrine. Once the epinephrine and norepinephrine are released, they act on special receptors in the organs and muscles and other tissues throughout the body to stimulate that fight and flight response. That's the get you out of that detrimental situation response. The SAM axis activation has wide-ranging physiological effects that help with the fight and flight response, and those include increased heart rate and blood flow to the muscles, increased oxygen consumption, increased sodium and glucose levels, enhanced arousal and alertness. It helps you to focus your attention very quickly, and it helps improve cognition. The slow response. So the body actually does something really phenomenal. When you have that fast response and you have the epinephrine, the norepinephrine, the adrenaline, all of these things are being released, if it doesn't have something to rise up to meet it, you're going to have a crash. And so what happens is the body actually causes cortisol to be released to rise up and meet that, so that way you come down a little bit more smoothly instead of having that ephedrine crash or the adrenaline crash that some people have. When there is a slow response, the body responds in an interesting way. So for a lot of individuals, we have chronic day-to-day stressors, sometimes extreme. And you can have an internal stressor and an external stressor. An internal stressor is that chronic pain type presentation. Anxiety in and of itself, or GAD, is a form of a stressor, right? And an external stressor are the day-to-day things that are happening in our life that we have zero control over. That's just like coming into the office and having 50 small fires that you had to put out before actually getting done the work that you needed to do. But when you have that long-term stress reaction, the body actually does something very interesting, which is the adrenal gland, which is on top of the kidney. The body will ask the adrenal glands to start to produce more cortisol. That is what gets us through our stressful situations. And as that happens, the longer it happens, the adrenal gland actually gets bigger in order to compensate for the amount of cortisol that the body is asking for. However, if that continues for too long, at some point the adrenal gland is going to go, I'm giving it all I got. I cannot give you any more. In fact, I'm going to start cutting some of this off. And it starts to atrophy. And as it starts to atrophy, the cortisol starts to decrease. When that happens, we start to enter into what's referred to as adrenal fatigue. If it continues, into adrenal burnout. And so what is the mechanism that's happening there? Within this slow response, right? So it's activating what's referred to as the HPA axis, the hypothalamus pituitary adrenal axis. And the stress triggers the hypothalamus in the brain to say, okay, you need to start releasing this corticotropin releasing hormone, the CRH, into the bloodstream. The CRH then triggers to release the adrenal corticotropin hormone into the bloodstream. And from there, the adrenal corticotropin stimulates the adrenal glands, those glands on top of your kidneys, to start to release cortisol and other glucocorticoid hormones into the bloodstream. The APA says that cortisol can cause the following effects on the body, and this is for short-term responses, right? So it can increase the blood glucose, it can increase glucose uptake in the brain, and it can reduce inflammation. However, if the body is constantly pumping this cortisol at a higher level over an extended period of time, those effects are actually detrimental, and it can actually cause inflammation. So it's important to manage those stress levels. According to the APA, anxiety is a normal reaction to stress. Mild levels of anxiety can be beneficial in many situations. Anxiety refers to the anticipation of a future concern and is more associated with muscle tension and avoidance behavior. Fear is an emotional response to an immediate threat and is associated with that fight, flight, and freeze response. According to a Harvard Health blog, anxiety has three main components: emotional, physiological, and cognitive. Those emotional symptoms are feelings of fear and dread or alarm. The physiological are nervousness, restlessness, tension, increased heart rate, rapid breathing, sweating, trembling, that feeling of weak or being tired, difficulty sleeping, and sometimes GI problems. Cognitive symptoms include worrying about what needs to be done, being able to perform them, and having enough time to actually do them. It also includes negative thoughts about what might happen. So imagine you have this presentation coming up at work. You might notice feelings of fear and dread, which are two examples of the emotional component. You may also notice bodily sensations such as heart palpitations, sweating, or tightness in the stomach, which represent the physiological component. Finally, you might be thinking, I can't do it. I am going to embarrass myself. Worries and negative thoughts like these about what might happen in the future are the cognitive component. So while worry is an important part of anxiety, it is only one of the three main building blocks. And I apologize, I'm not sure how this slide got jumbled, but it did. Understanding anxiety. When does normal anxiety become an anxiety disorder? Occasionally, feelings of anxiety are normal, like we've been saying. However, if the anxiety does not go away and it gets worse over time, it can be associated with an anxiety disorder. Also, these symptoms of nervousness, worry, and avoidance interfere with daily activities such as work, school, home life, and relationships. Anxiety disorders are among the most common mental health disorders, and it's affecting an estimated 15 to 20% of people at some point in their life. There are several different types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety, and phobia-related disorders. I want to say here that PTSD used to be considered an anxiety disorder, but has now since been reclassified under new criteria. Women are twice as likely to be diagnosed with GAD. That's the generalized anxiety disorder. It's not uncommon that when you have GAD, that you have other types of anxiety disorders and or depression as a combination. GAD affects approximately 6.8 million adults, and only about 43% of them are actually receiving treatment. So in order to receive a diagnosis of GAD, symptoms are present more days than not and has lasted for at least 6 months. The triggers of GAD are environmental stressors, medication or substance misuse, health conditions such as hypothyroidism or chronic illness. It's really important that you seek help if your symptoms start to get worse. And according to traditional Chinese medicine, and we're going to talk more about this later on, is within the concepts of traditional Chinese medicine, pathology and disease can actually result when emotions are not properly resolved. Western medicine treatment options for anxiety disorders. Western medicine really takes a look at and investigates not only the biological, but also the behavioral aspects of an anxiety disorder. And it targets the appropriate behavioral and physiological systems for treatment. So it's important that you work with your doctor to identify underlying medical conditions contributing to those anxiety symptoms. And those might include thyroid disorders, cardiac arrhythmias, menopause, PMS, and possibly even seizures. Medications can also play a role in creating anxiety, and it can be a side effect of some medications, including amphetamines, withdrawals from benzodiazepines, alcohol, and other addictive drugs. Caffeine can cause anxiety issues, ephedrine, and so can steroids. As I mentioned, it's so important to work with your doctors to identify some of these underlying causes and conditions. Treatment decisions are informed by the underlying causes of your anxiety and how the anxiety is affecting your ability to function in life. Many anxiety sufferers find a combination of both traditional and integrative treatment options to be optimal. Typical treatments for anxiety include various forms of psychotherapy, usually in combination with medications and or with medications by itself. Research suggests that exercise helps to reduce anxiety. So it's really important to get out there and get your steps in, go to the gym, take a walk, do things that are going to help invigorate your system. It may take some trial and error to find the right combination for your body and circumstances, so it's important to stick with it. Western medicine treatment options have a number of different therapeutic techniques. Cognitive behavioral therapy, that's one that most people know, focuses on helping you develop better coping skills and learn to gradually return to the activities you have been avoiding because of the anxiety. This is practiced by mental health practitioners. Somatic therapy is a form of body-centered therapy that looks at the connection of mind and body and uses both psychotherapy and physical therapies for holistic healing. In addition to talk therapy, somatic therapy practitioners use mind-body exercises and other physical techniques to help release the pent-up tension that negatively affects the patient's physical and emotional well-being. It's practiced by mental health practitioners with special training in somatic therapy. EMDR, or eye movement desensitization and reprocessing, is a mental health treatment technique. This method involves moving your eyes in a specific way while you process traumatic or stressful memories. Compared to other methods, EMDR is still relatively new. Initially, it was best known for treating trauma disorders like PTSD, and it is now also widely used for many other disorders, including anxiety and depression disorders. It's practiced by mental health practitioners that are trained specially in EMDR. EFT, or emotional freedom technique, involves tapping on specific points while focusing on an emotion or issue you want to release. Anyone can be certified in EFT. It is a method that is known to many healthcare and mental health professionals. EFT may be taught to patients as a self-care technique. It may also be used as an integrative treatment modality within therapy sessions. Some mental health practitioners use the EFT within their treatment sessions. NET, neuro-emotional technique, is a mind-body method for finding and removing unresolved stress reactions that trigger a range of chronic physical and behavioral conditions such as body pains, headaches, and anxiety and depression. NET is practiced by a variety of licensed professionals, including mental health professionals, acupuncturists, occupational therapists, and chiropractors. Those who are not mental health professionals focus on the body aspect of healing and work collaboratively with mental health professionals. Transmagnetic stimulation, or TMS, is a non-invasive treatment technique that uses a magnetic field to influence brain activity. It is used to treat brain-related conditions like depression or obsessive-compulsive disorder when other treatment approaches aren't effective. The side effects are usually mild and temporary. It's practiced by specially trained medical professionals. The medications that are frequently used to treat anxiety are antidepressants and benzodiazepines, or benzos. TCM and anxiety. The picture on the screen actually shows a auricular or ear acupuncture protocol specifically for stress reduction. So this is something you might see when you come to an acupuncturist. Before I get too much into the TCM side of things, I do want to point out that there is a lot of research that's out there in regards to TCM and anxiety. This is actually a small study that was done out of China in 2019, and it included 80 patients with clinically diagnosed generalized anxiety disorders, and they were placed into randomly assigned they were randomly assigned to receive one of two different types of treatments, either the traditional SSRI or acupuncture and herbs. Both groups saw improvements across all areas. The TCM group's improvement was significantly greater, with a total effective rate of 97.5% compared to the 80% with the SSRI. So, traditional Chinese medicine practitioners take into consideration all symptoms and categorize them into what's referred to as patterns. So we treat based on your Chinese medicine pattern. When we refer to an organ system, we don't mean the physiological organ system that you can see, touch, and feel, but how it pertains to traditional Chinese medicine. And each organ system has not only its own energetics and functions, but its own channels and meridians. So it's how the energy moves smoothly throughout your body. This allows for us to take a holistic approach and to address the entire body. When you come to a TCM practitioner or an acupuncturist, a session may include advice on diet, lifestyle, herbal recommendations, and of course, acupuncture. According to TCM, anxiety can be caused by the energetic damage or disruption to the energy flow of the heart, liver, spleen, or kidney organ systems or meridians. And so the goal of Chinese medicine is really to bring the body back into a harmonious state. There's 7 commonly seen patterns associated with anxiety, according to Chinese medicine. You could have one or you can have many. Everyone is a little bit different. And that's, again, why we do such a detailed intake, is because we might have 5 people come to us for anxiety, and each and every single one of them would be treated differently based on their unique presentation. So some of these commonly seen patterns are heart and qi deficiency and blood stasis, liver qi stagnation with phlegm fire. This is your anxiety, worry, and easily angered. The heart qi stagnation and blood stasis pattern, heart qi deficiency pattern, heart, blood, and spleen qi deficiency pattern. This is actually a really common pattern. There's a very, very famous formula. It's called Guipi Tong. It's thousands of years old. And we call it the student formula because students have a tendency to have cyclical overthinking and rumination and insomnia, irritability, anxiety. So it's a very nice, nourishing formula to help students get through school. The heart and kidney yin deficiency with fire engulfing, or we refer to that as a heat pattern, a deficiency heat pattern. And also the heart and gallbladder qi deficiency pattern, which those are your anxiety attacks. Quick and easy acupressure for anxiety. So here are some tools that you can utilize on a day-to-day basis in order to help regulate your system to prevent those anxiety attacks. Certainly, you can absolutely use it during situations where you are feeling overly anxious, but this is something good to help with the interim as well. So pericardium 6 is beneficial for nausea, anxiety, racing heartbeats, and wrist pain. This point is located on the palm side of the wrist, 3 finger widths above the wrist crease. It's between the tendons. And on this picture, it is located with the blue dots. The conception vessel, 17, which is Sea of Tranquility, it's also referred to as REN 17, is beneficial for opening the chest, for deep breathing, activates the thymus gland, and calms the mind. It also relieves nervousness, anxiety, depression, anguish, hysteria, and other emotional imbalances. This point is located in the center of the breastbone between the breasts. And you can find the indentation in the breastbone 4 widths above the base. As you hold CV17, concentrate on taking slow, deep, rhythmic breaths into your heart center for about 3 minutes. REN 4, or conception vessel 4, also referred to as first gate, is good for developing emotional stability and deepening spiritual awareness. It strengthens sense of self, used for energetic grounding and to help alleviate addiction and codependency. This point is located 2 finger widths below the navel on the midline of the body, right above the lower abdomen region. It's also known as the dantian, and if you practice qigong, or the hara in Japanese. Hara means abdomen in Japanese. Research has shown that breathing into the hara, or the lower abdomen, stimulates the vagus nerve and calms the sympathetic nervous system, right? So it's going to have an effect on that cortisol and that fight and flight response. And the way that you can utilize this point is while holding this onto this point, you can slowly breathe into the lower abdomen, finding the rhythm of the breath and allowing for that the tension in your muscles to start to release. When you breathe into CV4, conception vessel 4, as you breathe into that lower point, really start to find the rhythm of the breath. It should start to feel like the undulation of a wave. Just something to take note of. You may find it helpful to combine both conception vessel 17 and conception vessel 4 at the same time. So you can do that by placing your palms over each point, while at the same time taking deep diaphragmatic breaths or focusing that breath into that conception vessel 4 point. When activating PC6, the pericardium 6 point, you can either hold it firmly or gently massage. Okay? This point also is very, very beneficial when you're flying, and if you experience anxiety, stress, or even nausea. They have those little wristbands that you can actually, with magnets, that you can apply there. When to see a doctor? If you feel like you're worrying too much and it's interfering with your work relationships or other parts of your life, certainly see a doctor. If your fear, worry, or anxiety is upsetting to you and is difficult to control, or you feel depressed, have trouble with alcohol or drug use, or have other mental health concerns along with anxiety, or if you think your anxiety could be linked to other health problems. And this is really important. If you or a loved one are having suicidal thoughts or are in crisis, seek emergency help immediately. The crisis hotline is 988. That is your suicide and crisis lifeline. You can text or call that number. This is a list of all of the references that have been used in order to create this presentation. And I just want to take a minute and thank you for staying and watching this presentation. If you have any other questions about acupuncture or TCM and anxiety, I invite you to reach out to us, and I'm happy to answer any questions that you might have. Thank you.